So good morning. Welcome to our webinar, Partnering to Prevent Colon Cancer. My name is Ashley Teague, and I'm a Regional Cancer Control Specialist with the Kentucky Cancer Program. I'm joined today by Jennifer Wilson, my colleague, and from Kentucky Cancer Link, Melissa Carr. If you wouldn't mind, go ahead and type your name and organization into the chat box. We just want to keep track of who is in this webinar so we can follow up with you afterwards. We want to thank you for joining us this morning. We know it's very early, so we will try our best to keep it under 30 minutes. We've been pretty good at it so far. So our goal for today is to let you know about the Kentucky Colon Cancer Screening and Prevention Program. We often refer to it as KCCSP because that's a lot easier to say. And it's a program for uninsured and underinsured men and women that give them access to colon cancer screening. In the midst of COVID, we realized how important our overall health is. And so we just want to make sure that you all have the information for your patients to help overcome any kind of barriers they may have. So if you have any questions today, please type those in the chat. We will have a short Q&A session at the end of this webinar. If it's a specific question, kind of about a specific patient, you can still ask that question, but we may respond back to you in an email. Instead of addressing that in the group as a whole. Also, throughout this webinar, we're going to do a couple polls, and really we just want to know information about you and what you know. And so the first poll, if I can pull it up, we just want to know what kind of organization you represent. We want to know who our audience is today. So if you could go ahead and click those answers real quick. Give you just a few more seconds. All right, so we'll go ahead and end that. And as we can see, we have a lot of healthcare people, which we expected, but some of our education and community organization partners are on here as well. So our next question is, let me get to it. How familiar are you with the Kentucky Colon Cancer Screening and Prevention Program? Are you very familiar? You refer people already? Somewhat familiar, you've kind of heard the name before, but don't know that much about the program, or you have no clue what we're talking about. All right, that was quick answers. Okay, so as we can see, most people are somewhat familiar with this program. We do have some that aren't familiar at all. So our hope is at the end of this webinar that you know more about this program and it's something that you can utilize within your organization. Okay. So now a little bit about the Kentucky Colon Cancer Screening and Prevention Program. It was actually established by the Kentucky Department for Public Health back in 2008, so it's been around for a little while. The goal is to reduce deaths through prevention and early detection. So the program is going to follow the most recent ACS, or American Cancer Society, guidelines. So those guidelines right now for colon cancer screening is that you begin screening at age 45. Or before 45 if you have a family history or symptoms of colon cancer. The program right now focuses on the use of Cologuard. That's the at-home DNA test. You may be familiar with the commercial of the dancing box. They use that as well as colonoscopies for those people that actually have family history or symptoms or a positive stool test. So now I'm going to turn it over to Melissa Carr from Kentucky Cancer Link to tell us a little bit about their program and their role with KCCSP.
And very glad to be here with you all this morning. I'm Melissa Carr. I'm the director of Kentucky Cancer Link, and we are a nonprofit organization that partners with the program to provide patient navigation and help link Kentuckians to these programs. So I do have just a few slides with just some program info. I'm going to see if I can pull this up here. And let me get to, let's see. Okay, All right. So the Kentucky Colon Cancer Screening and Prevention Program, as Ashley said, is housed at the Kentucky Department for Public Health. And our legislators over the last, many years have been very supportive of this program. So they do put funding in the budget each time to be able to help support our efforts in prevention. So the program right now, as Ashley mentioned as well, has two parts. I'm going to focus on the bottom part first with the Cologuard. So Cologuard, or the program, received a donation of kits that we're able to distribute at no cost to Kentuckians who just meet a few eligibility requirements. They do need to be average risk, so folks that don't have family history, don't have current symptoms, don't have previous polyps from Cologuard or from a colonoscopy, precancerous polyps. So really hitting that age 45 to 75. The financial eligibility is 300% at or below the federal poverty guidelines. And that's based on individual income, which is different than a lot of other programs that focus on households. So it really does open it up to a larger number of Kentuckians. I think right now with the new 2022 guidelines that just came out, an individual can make just over $40,000 and be eligible for the program. So this is for Kentucky residents, but we do extend it to those who are in Kentucky on a work or a school visa with a green card, or if they're a refugee. So also that uninsured population, or it has underinsured here because there are many plans right now that don't have preventive coverage. It also covers Medicare participants that do not have Part B. So we, just really are proud of being able to offer it to quite a few folks. A question was asked in another session, if insurance does not cover screening at 45, would they be eligible? And that answer is yes. We would make sure that we could get them enrolled. And so again, that just shows the generosity of the program. The good news is too, that if there's a positive Cologuard, if they've met these eligibility guidelines, then they would automatically be able to receive that free colonoscopy, which is the other side of the program, where we have partnerships across the Commonwealth with providers that have signed on to be participating sites. I'll have a map of that in just a minute. And while we have these sites in certain areas, this is a statewide program. So regardless of where they live, we can help reduce barriers to get them to one of the sites and work with them as best as we can. And our goal in the next cycle is to expand and fill some gaps as well. So again, the financial is that 300% federal poverty guidelines, ages 45 to 75 for this colonoscopy. It can be younger if they're having high risk symptoms or if they have a significant family history. Again, those guidelines for Kentucky resident, uninsured or underinsured. So people that have had polyps in the past and now have to go back for that surveillance colonoscopy usually end up having a copay, high deductible. So those are folks that we can help offset that cost as well. And both of these are no cost at all to the patient. So those are the guidelines. And here's the map that we've secured providers so far. As you can see in the eastern part of the state, we have great partnerships with ARH. Many of their facilities have come on board to be providers. Also with Pikeville Medical Center. Here in Fayette County, we have a partnership with Colorectal Associates. And while they're in Fayette County, it does serve a wide range of extended counties as well. And then up in Northern Kentucky, we have a great partnership with St. Elizabeth. And our goal in the next cycle is to really fill in a couple more gaps up in the northeastern part of the state, and then also kind of that central South Central area to make sure that we can have a place within a good range for somebody to be able to go. Third is how you refer your patients. So you're welcome to give us a call. Our numbers are listed there. We have a local and a toll-free number. We have certified patient navigators. We are also certified as community health workers. And so we really work one-on-one with the patient to get them into the program they are a best fit for, based on what is recommended by their physician or a provider there. You can go to our website, kycancerlink.org. If you go to the How Can We Help tab and scroll down, there's a provider request for assistance, which has our referral form that you can fill out and fax to us. And then also there's a QR code that allows an online submission that then they'll be contacted by a patient navigator. So we work one-on-one with the patients. Any results are filtered back to the referring provider to make sure that everybody's in the loop. So just try to help be a link to hope to these folks. And we're happy with our partnership with KCP and looking forward to all the great work that's being done. I know that that's a lot of words for the eligibility requirements. I don't want that to be overwhelming or a barrier of any kind. Always feel free to reach out and discuss that further, or send your patients and we'll be able to talk it through with them in a way that that is easily understood and that. So I appreciate the chance to be here.
Thank you, Melissa. Like Ashley mentioned before, I'm a co-worker of Ashley's with the Kentucky Cancer Program. I'm the regional cancer control specialist for the Big Sandy area as well as the Five Co area. And I'm just going to follow up a little bit with what Melissa said. KCCSP is all about partnerships with KCL, KCP, the state, but also with the organizations that all of you all represent. And so I'm going to go ahead and share my screen now for a minute. Here we go. All right. Can you all see that? Yes. Okay.
No, I can't see it.
Okay, hold on. Sorry about that, guys. Let's try this. Now, can you see it? Perfect. Sorry. I have two screens and it sometimes is a bit challenging. There we go. Okay. So this is a map of the Kentucky Cancer Program Regional Cancer Control Specialist. Like I said, we have a representative in each of the ad districts, so you can kind of see that some are listed in teal and some in purple. So their KCP is split up into two different sections, the western part, which is through the University of Louisville, and the eastern part, which is through the University of Kentucky. We will be sending these slides out. So if you don't have the contact information for your KCC or KCP representative, you'll be able to get their email, their phone number, and these representatives live in their ad districts. So it's important for us to be out in these communities, and we want to serve our area, but we live right there with all of our partners. Some of the materials that we can help provide your organization. This is the first that you can use either as a flyer or we can get those printed into a larger poster size. It's just the general public flyer. So it hits the high spots of what Melissa talked about earlier. If somebody is in need of a colon cancer screening, they need they're uninsured or have high deductibles, just a kind of very brief overview that you can give someone who might be eligible. It also has the phone number to KCL. And you can see here that it says free colon cancer screening. So instead of saying just Cologuard or just colonoscopy, they leave it at colon cancer screening because we know that each person may have a different need. This is a social media post. We know a lot of organizations are making social media post about colon cancer during the month of March because it is Colon Cancer Awareness Month. But we can send these to you, and you have a place you can see it says insert partner here. And so you can add your logo to that as well. Specifically, if you're a clinic and stuff and you're trying to increase people coming in to get that information, you can put your information there. But these are great to either do as the header of your social media page or your website, or you can just make a post about it to share. This is our panel cards for provider eligibility. These are great for your general practitioners, your PAs, your nurse practitioners. Even I know I saw a lot of people who work for Kentucky Home Place. These are great for you all to use to be able to kind of really do a quick reference to see who you might want to encourage to call about the program. So it has a little more detail than just the general flyer about eligibility, why screenings are important, and symptoms that they may have that would really encourage people to get those screenings. And then we do outreach events. I know I have an outreach event today with one of our attendees, Miss Angela McGuire. But so we have the mega colon. Actually, KCP East has 3 mega colons that we can spread out through the region. If you're interested in having it come to your community, you can reach out to your KCP representative and we can get that scheduled. March is always very busy because it is colon cancer awareness, but we want to support and promote this program year round. So if there's anything that you have going on in your community, or you want to do something at your clinic to push this and colon cancer screenings, we can have that, we can schedule that. You can see it is quite large. You do need a pretty good space to be able to hold it. Sometimes we do have it outside, but the weather does not always cooperate. So nobody wants to see a flying colon go through the air. So it's great if you do have a big space. And then you can see here at the top of the picture, you may not be able to read that, but that's we have little magnet reminders. And it says, let's wipe out colon cancer. And so we're giving away as a little kitschy incentive, a roll of toilet paper for people who stop by and talk to us about the KCCSP program. And it has the contact information in there as well. So these are all great things and materials. After this call, you'll get a follow-up from the representative in your area, just thanking you for attending, sharing the link, the recording link of the video, so you can share that with your coworkers, but also seeing if there's any of these materials that you would like us to bring to you. So if you could use the flyers, or if you could benefit from some panel cards, or if you want to follow up and schedule some type of outreach event with your KCP staff, we'll be happy to do that. And I'm going to turn it back to Ashley to take some questions for either the KCP staff or for Melissa at KCL.
All right. So just one side note is that after this webinar, you will be getting an email from your KCP Regional Cancer Control Specialist, and it will contain the slides from both Melissa and Jennifer, as well as a copy of a video of this webinar, and asking if you need any assistance or materials or anything like that. So be expecting that email. It may be the first of next week, but we will definitely get all of this information to you. Does anyone have any questions? There aren't any questions in the chat. Did we just do a marvelous job of explaining this program? Or it may be that you think of a question later, which is always what happens to me. Feel free to email that to us and we will get an answer for you if you don't have a question now. And Melissa put her email in the chat as well. So no questions. Wow, guys, we did that in 20 minutes. So I hope you got some good information that you can use and you can use with your patients or your clients. And we really hope to get this program going even more than it is right now. It's such a great program and it's very, very much needed in our area. So I hope we can utilize it well. I want to thank you all for joining us this morning. I know it was bright and early to be talking about colon cancer, but thank you all again, and also be expecting those emails soon. So have a great day, guys.